KSSK Radio. You know what? A lot of people, I had no idea this was as big a problem until I have several people in my family right now, my extended family, who need treatment for vein problems. So where do you go for a vein problem? Well, luckily, there's a whole clinic about that, the Vein Clinic of Hawaii. Vein Clinics of Hawaii. Dr. Randall Juleff, how are you doing today, by the way?
I'm doing well, Mike. Thanks very much.
No problem. Who is now getting treated there at the Vein Clinics of Hawaii?
Well, we see people who have a condition that is referred to as chronic venous insufficiency.
Uh-huh.
And basically all that means is that the veins, typically in our legs, are not functioning the way they should. And, veins, as you might recall from high school biology, veins are the blood vessels that carry blood back to the heart. Arteries are the blood vessels that carry blood from the heart to, our entire body. Mm-hmm. You can have problems on either side, either arterial or venous side. But the issues that we deal with are, like I said, problems with veins. They're not transporting the blood back up to the heart the way they should. And basically what happens is that rather than the blood consistently moving upward, it starts to settle down into the lower leg, and then it creates the symptoms that it causes. And I try to kind of get this information out to people, so that's why I appreciate you having me on today. I think that most people relate vein problems of the legs with varicose veins. So, that's an easy association. People see, these bulgy veins on their legs, and they say, gee, I have a vein problem. So they go see their doctor, and then it goes from there. But there's a whole host of other symptoms that people might have that are related to this problem with the veins. And the veins that are failing are the veins that are deeper in the leg. They're not the veins that you see superficially. So it can create symptoms like achiness, fatigue, heaviness, muscle cramping, swelling in the lower leg.
Okay,
and we see that all the time.
So what we see out there, those the ugly varicose veins and everything, that could be just the tip of the iceberg, or it could be not the problem whatsoever as far as the achiness and all that.
Exactly. Yeah, exactly. The varicose veins nearly always are associated with that abnormal function of the deeper veins. But again, the message I try to get out is that you can have a whole host of other symptoms that with your legs that are also related to the poor function of the deeper veins, and you may not even have one varicose vein superficially. As a matter of fact, there's a number of people out there who have perfectly normal-looking legs, nothing superficially, that have this, abnormal vein function of the deeper veins, and they have symptoms like, muscle cramping, restless leg, which can be very interfering with quality of life. For instance, the issue of muscle cramping, especially in our older patients, it can be very disruptive to their sleep habits and their sleep patterns, and and thereby affect their quality of life in general tremendously. So, and they don't know that it can be fixed.
Jeez, and
it can be very easily.
Well, that's the thing. The Vein Clinics of Hawaii, that's what they do. Dr. Randall Juleff is a vascular specialist. Actually, cardiac surgery is where you started, right?
Yeah, my initial training was in what's called peripheral vascular. That has more to do with the arterial side, and then also cardiac surgery. So I did open heart surgery for a good number of years before I decided to kind of, subspecialize completely within the vein world. And there's a lot of different specialties that are out there doing this kind of work. I guess I'm a little biased. I think that it has always, vein disease has always been treated, traditionally by surgical trained type physicians. So I'm a little biased in that way.
It's okay to be biased. That's fine.
Yeah.
Look, this is a lot more common than I thought, and it sounds like the treatments have probably changed a lot over the years because I'm hearing more about it right now. What's the most important message if somebody thinks, okay, what he's talking about might be what I've got. I got this ache in my legs. I got this restless leg thing. I have some symptoms here. I don't see anything necessarily. What do I do?
Yeah. Well, they should come see us. But the message is the symptoms of venous insufficiency, they come on very slowly and over a very long period of time. So people tend to just get used to having those symptoms, or they chalk it up to something else. I mean, we hear all the time people come in and we talk about the symptoms that they might be having. And they say, well, I'm just getting old, and that's why my legs are tired. And, at the end of the day, I've got to go home and elevate the legs to make them feel better. Well, it's not just because you're getting old. There may very well be a functional problem with your circulation that, again, can be remedied very easily. And the treatment of varicose veins and venous insufficiency has changed tremendously over the last 20 years.
For the better,
I think
too.
That's one of the deterrents for people coming in to see us is because, they heard about their mother or their grandmother going through big surgery and in the hospital all that sort of stuff. And it's all outpatient. Everything we do is very minimally invasive, and it's very, very easily tolerated, and people feel great afterward.
Dr. Juleff, how does somebody get in touch with Vein Clinic?
They can call us on the telephone, which in our phone number is 808-588-2955, or they can just visit our website, and we have offices on all four of the main islands, Oahu, Maui, Big Island, and Kauai. And as a matter of fact, after hearing from you this morning, I'm thinking about putting an office on Kure Atoll, just to bring not only modern vein care, but a word from the outside in.
Yeah, they need it badly. Actually, no, they don't. They're probably the happiest people in the universe right now.
Exactly.
Dr. Juleff, Vein Clinic. That's, if you want to look it up, it's Vein, not VAIN. Those are for plastic surgeons. He's a cardiologist and a vascular guy. VEIN Clinic of Hawaii. Thank you, Dr. Juleff. Appreciate it. Have a great Thanksgiving.
Okay, you too, Mike. Thank you.
Keeping you in touch with Hawaii's most accurate news. This is KSSK.